it wasn't really on anyone's radar until really 2015, where we saw these surge of cases of microcephaly, the small brain congenital abnormality, which does exist even without Zika, but at a very low level. And there was a clear spike in Brazil. So this is going to remain, for the most part, a disease of travel, okay? If someone from the United States travels to an endemic area with Zika, of course they can pick up Zika. Additionally, there is that sexual transmission component. So we will see this in patients whose partners have traveled to endemic areas where Zika is, that their sexual partners could acquire Zika. So we will see that.
You know, I think the thought is not every woman with Zika will have a baby that has microcephaly. And you might say, well, why will certain ones? That part is unknown. I mean, obviously there's a lot of research and development going on trying to look at that causal association, as well as look at things like vaccines and ways to prevent it. But I think the message that is important to get out is that, okay, we know there is an association, so the best thing you can do to protect yourself and your unborn baby or future unborn babies is to try to avoid getting the virus. How can you do that? Well, certainly if you're outside, you can wear long sleeves. Definitely wear bug spray, insect repellent. There's a lot of concern, especially in women who are pregnant, should they expose themselves to chemicals. And our feeling is it is a lot more risky to get Zika virus than it is to use chemical repellent.
The real focus should be on protecting our pregnant women, and the focus as providers has to be, we have to tell our pregnant women, or women who are about to become pregnant, that they should really try to avoid Zika endemic areas. So people ask me, should I want to go, I've been invited to the Olympics, or I have tickets, should I not go now? And the real answer of what I say is, are you going to be pregnant or planning to be pregnant around that time? If the answer is yes, then I would avoid it. But in the absence of that, for everyone else, you're very lucky, go and enjoy.